we can use that God complexes in the treatment of leishmaniasis. So basically, what is leishmaniasis? In Hindi, we basically known it as a kala bukhar. I think you every person of here is heard about it. So it is a parasitic disease basically, and it is caused by the infection with leishmania parasite, which is spread by the bite of infected sandflies, and over 90 sandfly species are known to transmit the leishmania parasites. It is caused by protozoa parasite, which is transmitted by the bite of infected female phlebotomine sandflies, and the disease affect some of the world's population, and it is totally associated with the malnutrition, population displacement, poor housing, a weak immune system, and the lack of financial resources. As we move further, there are basically the three major forms of this disease. The first one is the visceral leishmaniasis, and it is basically known as the Kala Azar. It is fatal if left untreated over 95% of cases. It is characterized by irregular bouts of fever, and it was estimated that 50,000 to 90,000 new cases of visceral leishmaniasis are occur worldwide annually, and very few of them, that is about 25 to 45% of cases, are reported to the WHO, that is the World Health Organization. The next one is the cutaneous leishmaniasis, and it is the most common form which causes the skin lesions, mainly the ulcers, which might be painful or painless. And these can leave lifelong scars and cause serious disability or stigma. About 95% of this disease in these cases occur in the America, the Mediterranean basin, the Middle East and Central Asia. The last one is the mucocutaneous leishmaniasis. It leads to the total destruction of the mucous membrane. The mucous membrane is a very sensitive membrane which is present inside our throat and nose basically, and it is the moist layer on our skin. So basically the cases of mucocutaneous leishmaniasis are occur in the Bolivia, Brazil, Ethiopia and the Peru. So there are the modes of transmission. The sandfly is the most basic form of the transmission of the leishmania parasite. It is the primary mode, and the infected female sandfly is the primary mode of the transmission of leishmania. The next one is the zoonotic transmission. As the name suggests, the zoo, which is totally represented the animals. So when the leishmania disease is transmitted from animals such as the dogs to humans through the same sandfly vector, then it is known as the zoonotic transmission. The last one is the rare transmission, that sometimes it is very less common routes that the transmission caused through the blood transfusions, contaminated needles, vertical transmission from mother to child, and very rarely through sexual contact or laboratory accidents. Here is the life cycle of the sandfly. Firstly, as you show in the screen, that the adult female sandfly give the eggs, and about 30 days after, larva was formed, and the growth of larva was finally causes the development of pupae, and then it again forms the adult in about 40 to 45 days. So there are some geographical distributions, and there are some factors also which affect that geographical distribution. So the mainly cases which occur of this type of disease are found in Africa, Asia, Latin America, and visceral leishmaniasis is commonly observed in India, Bangladesh, Nepal, Sudan and Brazil. There are some factors that are the vector presence, climate, geographical barriers and human population density. So there are some symptoms and sign of these all type of leishmaniasis. So it totally depends on what type you have. So first is the cutaneous, and there are the symptoms of them. That is the skin sores, which are represented in the picture. They might be painful or painless. It was totally depend on the patient to patient and the immunity of that patient. The next one is the swollen lymph nodes, abdominal discomfort, night sweats, and weight loss. The next are the visceral leishmaniasis, and there are the symptom of that. The basic symptom of the visceral form is the swollen abdomen and the swollen lymph nodes. Lymph nodes are basically the bean-shaped glands which perform a very vital role in our immune system. In this picture, a child is suffering from visceral leishmaniasis was shown, and the next one is the mucosal, as the name represents that the mucus. So mucous membrane, as I told you, that it is present basically in our throat, in our mouth, and in our nose. So it totally affects these type of organs. So partial or total destruction of mucous membrane in nose, mouth, and throat was observable in this type of leishmaniasis. There are some diagnosis and treatment. So in visceral leishmaniasis, diagnosis is made by combining clinical signs with parasitological or serological tests. Serological tests are basically performed on the serums to observe the specific disease against the specific parasite. So the treatment of leishmaniasis totally depend on several factors, which include the type of disease you have, and the contaminated pathologies, parasite species, and the last one is the geographical distribution and the geographical location. All patients diagnosed with visceral leishmaniasis require prompt or complete treatment. As we move further, there are some medications which are basically used to treat leishmaniasis. The first one is the liposomal amphotericin B, miltefosine, pentavalent antimonials, and many more. There are some therapies which are basically given by the patients, by the providers. The first one is the thermotherapy, as the name suggests, the thermo, which is totally represent the heat. So in this, provider applies the heat to our ulcer and the area around it. The next one is the cryotherapy, as its name suggests, with the cooling. So provider cools an ulcer and the area around it for about 10 to 30 seconds per treatment. And the last one is the laser therapy, which was done by the handheld devices. There are some conventional therapies which I told you, and there are some recent advances which also include the immunomodulation, drug repurposing, and the nanotechnology. We are here to discuss about the medications one by one. The first one is the liposomal amphotericin B, and here is the structure of that particular medication, that it also contains a hydrophilic region, which in which carboxylic acid is present in the terminal, and which is basically the reason behind the nature of hydrophilic. The next one is the hydrophobic, which contain the polyene hydrocarbon chain, and the at the terminal side we observe the amine group, that is the mycosamine group. So these all constituents make the liposomal amphotericin B, and due to this complex nature, it can interact with our body, as our body also contain the lipophilic or lipophobic. So the medications are totally based on that type of things, so that they can interact with our body in a very well manner. So there are some side effects of this disease, that is the fever, chills, headaches, irregular heartbeat, muscle cramps, and pains. So basically there is a thing which is very notable, that what is the target side of that particular medication. So that is the ergosterol. Ergosterol is basically the principal sterol which is found in the fungal cytoplasmic membrane, and it is the target side of the lymphotericin B. So the next medication is the miltefosine, which was sold under the trade name Impavido, and here is the structure of the miltefosine. It is basically look like the natural phospholipid, that it contains a hydrocarbon chain, that is the long chain which is present in the left side, and in the right side there is a trimethylamine group which is attached to a phosphate group. So it is also similar to the structure and the complexes and the layer lipid membranes present in our body. There are also some side effects in which the Stevenson-Johnson syndrome is the most observable side effect of this disease, in which the mucous membrane of our body, that is from our throat and from our nose, they are totally so they destruct by the rashes, and these rashes are not so much curable, and it take a lot of time to be cured. The next medication is the paromomycin. So it is a sulfate, and it is the aminoglycoside which is belonging to a neomycin family. It is a broad spectrum antibiotic, and it is administered by intramuscular injection. The side effects are relatively limited, mainly the ototoxicity. Oto word is related to our ear, and when our ear got injured by taking some kind of medicine, then it is known as the ototoxicity. So these are some side effect, and the local pain of at the injection site is also observable. So in addition to the paromycin effect, mitochondrial membrane potential and modifies the amount of polar lipid in the membrane, perturbates the fluidity of the membrane, which leads to altered membrane permeability. Here is the structure of paromomycin. The next one is the pentamidine. It was available as the Pentam and the Lomidine in the markets. It is basically a second line treatment. Then if the first line treatment was not so much effective, then the second line treatment was given to a patient. So the pentamidine is reported to enter inside the kinetoplast via arginine and the polyamine transporter, and then affect the parasite DNA synthesis. So when the DNA synthesis was blocked, then ultimately the cell death of that parasite was done. So there are some metals which are used in this treatment. The first one is the antimony. So basically in antimony was found in +5 oxidation state, and the +3 oxidation state of antimony is very active, and when this active form was injected in the patient's body, then it interfere with the parasite's metabolism by inhibiting enzymes like tryptophan reductase and many more. Then it also disrupt the parasite's zinc finger proteins, which are involved in the DNA replication and repair. So there are the two models of the antimony. In the first one, it was reduced to the +3 oxidation state, and then it performed its function. But in the active SB +5 model, the SB +5 antimony in the +5 oxidation state is automatically active and form the complex with the DNA topoisomerase and many other enzymes, and ultimately the apoptosis was done. So there are some limitations, that it is toxic. Routes of administrations are potentially intravenously and intramuscularly. The next one is the drug resistance, and these are some limitations of antimony. So there are some other metal based approaches, like zinc and magnesium are also used in the anti-leishmania, and when a DNA metallo-intercalated, that is the platinum, showed a remarkable anti-leishmanial activity which causes complete growth inhibition of leishmania. And the next one is the peroxyvanadium compounds, which show potent inhibitors of protein tyrosine phosphate and inducers of anti-leishmania effects. As we move further, there are the zinc sulfate was also used as anti-leishmania drug, and it can be administered orally and been used from last decades in a medicine and dermatology. In vitro sensitives of Almazer and the Leishmania tropica strains to zinc were reported to higher than those of pentavalent antimony. It was delivered intralasally with success in cutaneous leishmaniasis, and it could have immunomodulatory effect, and which help in the wound healing, that the healing of the ulcers. As more recently it was administered orally to the Iraqi patients, and which are suffering from parasitologically, that confirmed the cutaneous leishmaniasis was cured. And the species which are not identified and is known are only Leishmania major and Leishmania tropica, which are present in that Iraq. It was suggested that systematic antimonial injections of cutaneous leishmaniasis treatment were better than zinc sulfate, but oral administration of zinc sulfate makes it cheaper, more convenient its consumption, and nearly close cure percentage to systematic meldumine antimoniate injections without any serious effects. So there are some clinically based gold based drugs which are used in as anti-leishmania. So in general, some metal drugs that have been used as the NTD, that is the neglected tropical disease, and researchers of bioinorganic scientific community are investigating the potential of organometallic complexes in the treatment of this disease. So there are some drugs which are formed from gold complexes, and the phosphine ligand was also used to make it more effective of the gold drugs. So phosphine ligand considered very important class of versatile ligands which interact with metal as sigma donor and pi acceptor. Many gold complexes have been of great biological interest, which are basically of large variety and structural diversity, which include the alkaline, nitrogen, phosphorus and sulfur. As we move further, why we need more drugs to treat leishmaniasis? Is the drugs available in market are not sufficient, or are not working? So current antimony based drugs are expensive, have numerous side effects, and are becoming increasingly less effective due to drug resistance. So novel treatments are urgently needed to combat this parasitic infection, as existing therapies often face the limitations. So, what about triazoles? As we are studied that triazole have a very good impact in the biological studies. What about the triazole if we use them as an anti-leishmania drugs? So, it is basically a 5-membered heterocyclic system which consisting of 2 carbon atom and 3 nitrogen atom. And triazole was used as anti-inflammatory, antiviral, antifungal, and many more. So, synthesis of 1,2,3 triazoles, as 1,2,3 triazole was basically used as the anti-leishmania drug. So, so there is the copper catalyzed azide, that is the alkyne cycloaddition. So in this reaction, when we one side we take the alkyne, and on the other side the organic azide was taken, and then the 1,4 isomer was formed. So there are basically the two methods in which they can be formed. The first one is the Huygens approach, and the last one is the second one is the click chemistry, that is the copper based approach. So the Huygens approach suffers from slow reaction, high temperature, and it is not regioselective. So we have to form only one type of compound, that is the 1,4, that which is more regioselective. So the copper approach is more better than the Huygens approach. So there are some properties of 1,2,3 triazole which are stable under the thermal and acidic condition, which are generally insensitive to redox hydrolysis and enzymatic hydrolysis. This type of ring is basic aromatic hydrocycle with a pyrrole type and 2 pyrimidine type nitrogen atom. As we move further, the question arises that can triazole used as anti-leishmanial drug? Basically the salt derived from the imidazole or from the triazole are obtained as potent anti-leishmania drugs. In recent year, they have received a very significant interest due to their versatile chemical characteristics, such as they have good stability, distinct electronic properties, and tunable reactivity. In addition to their impressive chemical application, they are ionic liquids, organic catalysis, polymer materials, and metal ligands. On moving ahead, they are recently focused on the strategy of designing new triazolium salt and investigating their anti-leishmania effect. It was observed that these salts derived from the triazole exhibited higher anti-leishmania activity in intra-macrophage amostigate and the promastigate of the different leishmania species. Amostigate and the promastigate are the two stages which are observed in the growth of the leishmania, and they are totally described about the differentiation in the locomotion, that the mastigate stages was stable and they cannot locomote, and the promastigates can done locomotion easily. So it is worth noting that the trizolium salt group is crucial for enhancing anti-leishmanial effect of molecule as it demonstrates better performance than neutral trizol, generally featuring the hydroxyl group attached to the fourth position of the trizol ring, or introduction of the epoxide group to the fourth position of the trizol ring makes them more potent against leishmaniasis. So there are some complications which are basically observed in the treatment of leishmania. The first one is the bacterial infection. As I told you that the ulcers are observed in that kind of disease. So it is also a secondary infection. They can make ulcers more worse. They can allow bacteria to get deep into your body, which can lead to serious illness. The next one is the scarring. It can cause permanent damage to your skin, mouth and nose, including severe scarring. The next one is the relapse. Some people symptoms go away with treatment only to come back later. Or if any person having the immunosuppressed, then the chances of relapsing is more often. The next is the septal perforation and the collapse. The mucosal leishmaniasis can cause a hole in the tissue between the passage of your nose, that is the nose septum or the nasal septum. The structure of your nose may break down in that kind of leishmania. This can cause disfigurement, infection and breathing problems. The pneumonia is also more complicated thing which was observed in the leishmania. Here is the figure in which the lungs or the bronchiole or the alveoli of the healthy person was shown, and in the next as the below, the pneumonia patient was shown that the bronchioles were swollen and the air space filled with the fluid. The post-Kala Azar dermal leishmaniasis, that is the PKDL, is large bumpy rash on your face and other area of your skin. It can appear while you have visceral leishmaniasis or after you have recovered. It can last long and cause severe scarring. The last one is the hemophagocytosis. This is the life-threatening condition that causes the organ damage. So at last we are here that how we can prevent the bite of sandfly so that we are not facing that kind of disease. So how can I prevent? So the best way to prevent all form of leishmania to avoid the sandfly bites, especially in the area of leishmania where it is common, ways to avoid bites include cover exposed skin with clothing including long pants, long sleeved shirts and socks. Wear EPA registered insect repellent. The most effective repellent usually contain the DEET, that is the N-N-diethylmetatoluidamine. So kill sandfly indoors by spraying living and sleeping areas with the insecticide. Sleep in a room with the window closed or with screens in the windows. Sleep under mosquito bed netting. Some netting is pre-treated with insect repellent for added protection. Sandflies are much smaller than mosquitoes, so netting and screens should have very small holes to keep flies out. Thank you.
Thank you, Ms. Rashmi. That was a very fascinating session. With that, we conclude day 3 of the Gyan course. We are grateful to all our speakers for their valuable time and to each participant for your active involvement and thoughtful questions throughout the day. We look forward to welcoming you all tomorrow for another day of learning, exploration and academic growth. Have a wonderful evening ahead.